2021 presented new challenges for the Ministry of Health as it battles the COVID-19 pandemic, with the first tranche of vaccines arriving in early 2021 and additions to the parallel healthcare system. The ministry itemized its spending into three categories: HR, infrastructure, and consumables. As we continue our TT Budget Matters series, Kimberly De Souza takes a look at how the ministry prioritized its spending.
The major fiscal 2021 allocations will be education and training, 7.973 billion, health, 6.050 billion.
It came as no surprise the Ministry of Health received the second largest allocation of the $49.57 billion budget for fiscal 2020 to 2021. Back in October 2020, when Minister of Finance Colm Imbert presented the budget in the lower house, the country was in the midst of the second wave of the COVID-19 pandemic, and health officials were establishing the rollout of the parallel healthcare system. Then in March 2021, during a debate of no confidence in the finance minister, Health Minister Terence Dayal Singh revealed that $332 million had been spent in COVID-19 treatment alone. Through loan financing, the ministry spent over $6 billion on health infrastructure, including $1.5 billion on the Point Fortin Hospital and $249 million on the Ministry of Health Administration building. In June, the ministry sought an additional $267 million in supplemental funding. $86 million was distributed among the regional health authorities, and $107 million was allocated towards the procurement of COVID-19 vaccines. As the country continued to receive other vaccines and COVID-19 variants made its way to our shores in September, Minister Dayal Singh revealed the government's COVID-19 fight focused on three areas: infrastructure, human resources, and consumables.
From the start of COVID, preparing from COVID to now, the Ministry of Health has spent $480 million on the COVID response.
Government also allocated an additional $50 million to the Tobago House of Assembly to fully operationalize the Mariah Health Centre and Roxborough Hospital, to repay outstanding debts, and to purchase medical equipment to battle the COVID-19 pandemic. Kimberly De Souza, TTT News.